Hi everyone, I am Dr.RUkmani Choudhary and my topic is autism. Nowadays it is called like autism spectrum disorder, ASD. So today's topic is all about this condition, and this is a neurological condition. See, I have already uploaded video by the name of ADSD, that is attention deficit hyperactive disorder. So this is like there are similarities with the autistic kid and ADHD kid, and there are dissimilarities, there are differences in both the kids. So we'll talk about this part also in the later section. So what is this condition? So this is a neurological condition, and that is characterized by having differences in socio communication interaction. There are differences, means these kids have differences, they are not as active as normal kids. So this is a neurological condition, and there are categories, and sometimes it is developed in the early childhood, and in some cases it is developed like with the age or with the time. About the category part, there are two basic categories. Like one is, the first one is having, there is a lack of socio communication interaction, or we call it, there is a difference of communication activities. So this is again, like it takes time of like almost 5 years, or it start developing in early childhood. So initially the autistic kid they do not make eye contact, and they do not respond even their name. So they do not respond and they do not make an eye contact. And yes, there is no feeling, like there is a no heart and no feeling, no expression of emotion. They are not engaging in certain games or activities. They have difficulty of expression of their emotions they have, and they do not even respond by the visual communications or non-verbal communication. To understand non-verbal is, there can be speech difficulties, speech communication problem, that is hyperlexia. And what is that? See, these kids at times they even read faster than the normal kids, but they do not understand, they do not comprehend. So that's why they have hyperlexia. They do not understand, they do not comprehend. But the category is like restrictive or repetitive activities. They are restricted to their activities, means they do not complete it, and they are repetitive in nature. They repeat that again and again. At times they spin a lot, and at times there's a shaking of head, moving like back and forth, and there is a running of back and forth all the time, and they are doing unintentionally things they do not understand, but they are still doing and running. Yes, there are repetitive activities, even repetition of words again and again. So there can be other characteristics with these autistic kids. These can be like a balance of their GIT, like at times they have a loose motion and constipation, diarrhea and constipation can be there, and metabolic disorders can be there, when epileptic fits, seizures can be there. So there can be other characteristic features. What causes this condition? Like what are the causes, and why these kids have developed these symptoms, and why they are not able to connect socially, communicate socially? There is not a single cause, no exact cause, no single cause, none for this. There are certain suspected risk factors believed, right? And there's a combination of genetic and environmental factor as well. And see, if you have the immediate family member, if someone has immediate family member, then there are chances genetic mutations are responsible, and maternal viral infection history can be there. And if there is a exposure of certain heavy or toxic metals, then this condition can be arises. And being born to older parents, if your parents are older, yes, in that case, having low birth weight head diagnosis part. Diagnosis is usually made by collecting of all your symptoms, because this is a broad spectrum condition, neurological condition. So we have to gather all the symptoms, like with your communication, behavior problem, all the activities, repetition, all the symptoms should be like collected, and screening should be there. Screening like audio visual screening can be there, genetical testing, genetical screening, DNA testing can be there. And see, determinative diagnosis is usually made by approaching your child psychologist, occupational therapist. What support we can provide them and what supports are there? See, there are behavior therapies, there are speech therapies, there are occupational therapies, meditation. These therapies can help the autistic kid. The condition is not curable, obviously, but this can be manageable with certain therapies and with homeopathy medicines and certain dietary and lifestyle changes. And by accepting it, therapies can be given. What about the diet link with the autistic or autism? See, diet plays an important, crucial role. The diet, you are not supposed to give these kids like artificial sweeteners, artificial color, and artificial preservatives. So just avoid all these things, and the healthy diet, the fresh fruits and vegetables, plenty of water, ample of water, and activity. If the kids is engaging certain types of games, you can engage the kids in the certain types of games. So these things can help. Even fish, homeopathic approach, how homeopathy can help or can support these autistic kids. See, we have different medicine. There are several medicine in homeopathy for all mental health issues, all neurological condition. And I have already uploaded video ADHD and bipolar disorders, personality disorders. There are different videos on my YouTube channel related with mental section, mental health condition. So there are different medicine, and the medicine works like on your individual approach, like what is your case, what total symptom you have in totality, what is your case, means whether you are having seizure with your condition or you are having loss of memory, loss of consciousness, whether you are not taking part in a game, are you hyperactive. So these symptoms matters a lot in homeopathy, and we have to collect all these symptoms. And these are not the limited medicine. There are several medicine, countless medicine in homeopathy, so that again goes with your case. So these are not limited one, but these are general clinical one, so you can use them. Agaricus muscarius, you can buy even a smaller quantity, and the place you belong, you might have the medicine in the pills form, tablet form, or in the liquid form or mother tincture form. Any form, just have smaller quantity of the medicine and just start with the lower dose. So this is in the dilution form, liquid form, in the drop form, so just have 1 or 2 drops. You are not supposed to use all the medicine. You are supposed to use the single medicine that is more similar, means you are having symptom with that medicine. So just use that medicine, buy that medicine only, don't buy all the medicine. So agaricus is given when you have like make sounds, confusion, you restlessness, slow response, you are restless, you make sound, the kids is making sound and there is a confusion all the time. So this is given in these kind of symptoms, so you can use. And if you're watching on YouTube, medicines link are given in description box below. You can buy, you can start. Be knowing very common medicine, and that is given in like all mental health cases where there is a violence, and there is an extreme of like patient is restless and there is a loss of consciousness, hallucination is there. In my split personality, I also explained or summed up about this medicine there also, that you have hallucination, there is abnormal sound you have. So in these cases, like minimum quantity, just 1 or 2 drops, and just have it like 2 or 3 weeks until the time you start feeling better. Cuprum is usually given in like seizure cases, epileptic fits cases, you have clenched thumbs, or you have shaking of head backward and forward all the time, fearfulness, the kid is fearful. So in these cases you can prescribe or give him cuprum metallicum. About the respiratory purpose or weakness purpose, fatigue purpose, phosphorus is given. But yes, in these cases like autistic kids cases, we have phosphorus given when the kid have the tendency of taking short nap. So in these cases, in the kids, they are very slender, they are lean thin, and they are tall. So in these cases, phosphorus works amazing. There is a fearfulness is there in the kids, so just use phosphorus again with the help of stramonium. Stramonium again in homeopathy, this is given when you have stammering or there's a speech problem, there is a stuttering. In that video I also explained about stramonium. So stramonium is given when speech problem is there, or loss of consciousness, even loss of memory. So in these cases stramonium works amazing. Stramonium, one medicine at a time, which is more similar to your case. which before that is functional disturbances of brain. This can act as a brain tonic or memory booster. You can use this is in the liquid form. Again, just have 5 or 10 drops of the medicine in some lukewarm water and just use it and like have like 2 or 3 months or even 4 weeks. It completely depends. This video can help you. If you find this video knowledgeable, informative, please like, share and subscribe my channel. Press the bell icon to get notified. Keep watching. Thank you for watching. Thank you for your time. Thank you so much.